Good morning, respiratory care fans from AARC Day 2 here in Orlando, Florida. All right, so kicking off Day 2 in Orlando, what you should expect is some CE opportunities in the morning with some industry-sponsored symposiums. They offer you a complimentary breakfast and you get an extra CEU, which is kind of nice. And then we've got regular CE sessions hosted by the conference, and then the AARC board meeting, which inducts the new board members, does a financial report, and then ends with passing of the gavel, where the AARC president's outgoing passes the gavel over to the incoming president. Day 2 is a little bit slower just because you've got more CE opportunities and a little bit less of the flashy things that take place on Day 1. Of course, we mentioned the welcoming party Day 1, as well as there was a Theravance hosted. And Day 2 is typically capped off by a party / meet and greet. I've been attending these meetings since 2008, so this is my 14th or 15th conference. And one thing that a lot of people that's their first time don't really understand is that it's really busy when you come to these conferences. There's always something going on. There's lots of awards. There's lots of different institutions like the NBRC, AARC, and AARC, like side meetings that are happening. The vendor hall is fantastic to go to. You don't want to miss out on that, but if you're going to that, you're going to miss some of the CE classes that are taking place. And so one nice thing are those vendor-sponsored or industry-sponsored breakfast symposiums that I was mentioning earlier. Provides you an opportunity to get some free food, which is nice, but then also you're going to listen to a sponsored CE. So they're going to have an industry expert speaking typically about something related to the products that they sell. And so it is sponsored, be aware of that, but it is a nice way to go ahead and get an extra CE while you're here. Another thing that first time or second time therapists should know when they're coming to the AARC conferences is to make sure you download the app for the conference, because these conferences are bigger than probably what you're used to at the state level. Now, some states are going to have multiple tracks and maybe 1 or 2 sessions going on at a time. A lot of the smaller states only have 1 session at a time, and so like you're just there, you're going to get everything, you're right in front of it. But at these conferences, you literally have 5, 6, 7, sometimes 8 sessions going on at a time. And what you really need to think about when attending this is what you're going to go to. Now, there's education tracks, there's research tracks, there's management tracks, there's poster presentations where people are presenting research, and all sorts of opportunities. But if you don't have the app, you're not going to be able to keep track of the schedule of when things are happening. So make sure you download that app. That way you can schedule out your days as to what they're going to look like, so you don't miss the sessions that are important to you. All right, so here we are outside the conference center for Day 2. Let's head inside and take a look.
Oximeters that were created, Google search it, and blow your mind.
There, the profile of the respiratory therapist was elevated, and you can see
anything that relates to transplant. So I follow up a lot of transplant patients. So it's a vast